In this video, we'd like to explain to you how to manage fear of hypoglycemia. There are several important points to make before we talk about method. And perhaps the best way to illustrate this is to show you the human brain. This depicts two parts of the brain, and it's important for us to recognize that the brain is a developmental organ. And what that means is that when new structures are developed in the brain over time, the old structures don't become disused. They continue to function and do what they've always done. So it's developmental in that context. But what's critically important from a behavior perspective and from an emotion perspective is that we actually have two brain systems that guide our feelings and our thoughts and our behaviors. On the bottom, you can see the limbic system of the brain, and this is a primitive brain. This is, in essence, iOS 1, the original operating system. This is an emotional, impulsive brain. So this system sends messages like, I want it all, I want it now. We also have, in the dorsolateral prefrontal cortex, the frontal lobes, which is the executive functions of the brain. This is the iOS 10. This is the logical brain, problem solving. The point here is that we have these two brain systems sending messages to us constantly. What's important about that is that then tells us why ambivalence is so powerful of an experience in humans, because we're pulled in two directions. We've got two brain systems, so of course we're pulled in two directions. It's also very important for me to emphasize that in a struggle in a human where the frontal lobes are sending messages that are inconsistent with the limbic system almost always wins. In other words, humans primarily are emotional and we're reactive. And that's important because most healthcare providers, when they're guiding people, they focus in on the frontal lobe type of communication. So fear of hypoglycemia, what are we going to tell somebody if they're having trouble? We're going to say, you know what, that's okay, we can help you. Let's talk about how to best manage your glucose. But in fact, the fear may be dominant. And so I need to make the point that one has to work through the limbic system. In other words, if you try to ignore the limbic system and appeal to the frontal lobes, it doesn't often work. If you give a person the opportunity to work through that emotions, the emotions get processed, those signals start to fade, and then the frontal lobes can kick in. So this is an important point for us to manage, especially around hypoglycemia. Now, fear of hypoglycemia is actually quite a common event, and this is one of the things that the survey-based research in the last several years has really helped us to understand, that hypoglycemic experiences are not uncommon, and they leave a big footprint, and all of us would understand this. If you think about serious hypoglycemia being defined as low to the point where the conscious ability to treat it is threatened or compromised. Now, people experience this as the essence of loss of control. And so it can be a very serious psychological impact for somebody. So do you know many patients who treat their lows adequately? So think about the way we would approach treating a low. 15 grams in 15 minutes, reassess. Is that how most of our patients manage their lows? Whether they measure their lows or whether they perceive their lows? Or do they simply eat until they feel better? And we both know that eating until you feel better is really the dominant response. And that's because it's an escape response. The person is in a fear state and they want to escape. We know that we can assess fear of hypoglycemia, and in a moment I'll demonstrate to you a scale that's been used for this. When fear dominates, fear of hypoglycemia, in fact, for many people, is more than a stressful event. Stressful events come and go, we deal with them, we move on, but basically we just absorb them into the background. And if you had a really difficult day 6 months ago because you were late for work and you spilled coffee on yourself and you got into an argument with somebody and then you got criticized later in the day, you may have experienced it at that time as a very stressful day, but you have no idea that you even happened now. It's a faded memory. But many fear events are more like traumas. And traumas alter memory in which the fear dominates. Where were you on 9/11? If you've ever been in a horrific accident, you'll remember it for a long time. So we know that traumas affect the brain and how it organizes their memory. Therefore, fear of hypoglycemia is important to understand as a fear management issue before a glycemic management issue. So we believe that it's important to ask our patients what their experience of hypoglycemia is. How much has it dominated their life? And if you recall your interviews with patients, it's not uncommon, is it, that a patient will tell us, oh yes, I had a low a year and a half ago and I've been worried about having another one since. In other words, that memory doesn't seem to fade as a normal stressful event does. I'd just quickly show you this hypoglycemia fear scale. And you can see that it's really rating people's experience of worry around having a low. They worry about being, not attending it, having hypoglycemia unawareness, not having a way of managing it, worrying about nocturnal, embarrassing themselves. These are the very common fear-related events. And this is a validated scale that talks about the worry attached to diabetes, hypoglycemia. And what's interesting about this scale, look at the date of the publication, 1987. So this tells us that we've known about this for a long time, and I think it's about time that we have a better strategy for managing the fear of hypoglycemia. So this is a guide for managing the fear of hypoglycemia. This is a publication that a group of my colleagues put together in 2014. And there are a number of steps that we would encourage you to engage in. Think of this as a dialogue tool. Don't think about yourself as having to be the expert. This is the collaborative tool. We simply screen your patients for hypoglycemia. Have you experienced hypoglycemic events? And you can determine the time frame for that, consistent with your normal interview procedures. If the person has had the experience of hypoglycemia, regardless of whether they're type 1 or type 2, and regardless of whether they're children or adults. Remember, with children, the parents are very involved in the care. So when we talk about this experience of fear of hypoglycemia, it's important to recognize that it may be more than just the patient if it's a child. It could be the family members. And then once you've screened for the experience of hypoglycemia, ask about fear of hypoglycemia. Do you live in fear of a future event? How strong is this fear? And a good interview tool to think about is just getting your patient to give you a rating of high, low, or moderate. So we don't have to go into the detailed psychometric evaluation, and this is something that if we had resources and the interest in, we might. But it might be also important to say, do you experience the fear of hypoglycemia, and how much fear do you experience, low, moderate, or high? When you encounter fear of hypoglycemia, then the following steps are helpful. First, normalize the fear response. So let the person know this makes perfect sense so they can understand their behavior, so they can accept their behavior. They don't have to feel bad about their behavior. Because as we've just illustrated, if the limbic system is screaming out, this is a scary event, then it's normal to run away from it. Once you've normalized that, then you start to explore, well, how do you manage your fear? What is it that you do to keep your fear at bay? And in particular, what we're looking for here is that very common compensatory hyperglycemia as a way of coping with fear of hypoglycemia. We know the best way to avoid being low is being high. And you've now got your patients in a situation where even if they recognize the long-term risks of hyperglycemia, they're faced with a situation where they've got an immediate fear of hypo, which they could die of today. And when you have a choice between avoiding dying today, but perhaps dying 30 years down the road or even 5 years down the road, then of course the limbic system is going to choose survival in the moment. So we explore these behavioral strategies. We then go into what we call the safety margin. I'll elaborate on that in a second, and use graduated behavioral exposure. So let's really talk then about what does this mean, graduated behavioral exposure. And so it begins with asking the patient their safe zone. What blood sugar range do you feel comfortable with right now? And I often ask it in the following way. When you leave the house in the morning, what is the sort of sugar range that you feel is sort of adequate? That is, it's not too high, but it's also not too low, so you know that you can get through the day without a hypoglycemic event. And then we don't make recommendations based on the ideal blood glucose range, but we anchor our recommendations about lowering the psychologically safe range to a medically safe range. So you have to accept that. That's the normalizing piece. Of course, it makes perfect sense that when you leave the house and you're between 12 and 15, you're feeling kind of comfortable because it's not terribly high, but you know you're not going to go low. So then what we do is we say, could we work together and negotiate this? But we let the patient be in charge. That's the empowerment piece. And then we try to figure out, okay, if you were going to get your psychologically safe zone to a medically safe zone, how do we do that? And then gradually shaping this. So if somebody had a 12 to 16 as their psychologically safe zone, we might say, would you be interested in maybe lowering that a little bit? And what would that be? And then you negotiate with the patient. Once a plan's established, the patient's on board, then, increased testing, hypoglycemic management strategy review come in really helpful. And then as this goes forward, the patient begins to experience a sense of empowerment. That is, the fear comes down, their sense of control goes up. So hopefully this will be a useful strategy to allow you to work with your patients to help them address this important challenge of fear of hypoglycemia. Thank you.